Welcome to SEDA Dental Smiles. I'm Morgan Thompson. Today, we'll be talking about dental implants. What are dental implants? What are all-on-fours and teeth in a day? And how far have dental implants come? You're not going to want to miss this show. On today's show, I'm joined by Dr. Kenneth Rubinstein. Hi, welcome to the show.
Hey Morgan, how are you?
I'm fantastic. So tell us a little bit about your background and experience.
Sure. I went to 4 years of dental school at Tufts in Boston. I did a GPR, which is a general residency at the University of Miami and Miami VA. And then I did a 3-year specialty training in implants and periodontics. But let's not forget, I've been practicing and placing dental implants for over 20 years.
So you have a lot of experience, but what exactly does being a dental implant specialist involve?
Our specialty involves the replacement and restoration of missing teeth as a result of tooth decay or gum disease.
So is dental implant technology constantly evolving?
Absolutely. We know what works, but more importantly, what doesn't work. The technology's there. Success rates are over 95, 98%. I could tell my patients predictably that this is going to work.
So this is a good time to be a patient.
The best.
What is a dental implant?
In simplest terms, a dental implant is the replacement of a natural tooth root inside the bone. When a tooth is decayed or has periodontal disease or maybe fractured, the root is extracted, and then the implant is inserted into the bone to allow us in the future to put a crown or sometimes a bridge to replace the missing tooth. Dental implants are made out of high-grade titanium, and all of our implants are made in the United States. We only use implants that have enough research and scientific backing that we know they're going to work long-term for the patients.
Now, how long do they last? Do I have to replace them every couple years?
If it's diagnosed and treatment planned correctly, and if there's regular maintenance, it can last a lifetime.
So can you take us through a simple implant procedure?
The first thing we do is we extract the tooth.
I'm not even touching your tongue, so don't worry. You did great. Tooth's out. Yep.
Then we give the patient a choice. Do we grind down 2 perfectly healthy teeth to prepare them for a 3-unit bridge, which is a traditional method? Or do we leave those teeth alone, don't traumatize them, and replace that missing tooth with a dental implant?
So what are the disadvantages to filing down the adjoining teeth?
The number one disadvantage is we're removing enamel and dentin on 2 perfectly healthy teeth. And that can invite root canals to the abutment teeth or the tooth that holds the bridge. The average survival rate of a fixed bridge like this without a further complication doesn't exceed 12 to 15 years. However, with implants now, we have 40 years of success rates. So the way we would do that is when we extract the tooth. My preferred protocol is to place the implant immediately. Several advantages to that is the healing process is faster. The socket where the root was is already primed with healing factors and hormones that lead to better integration and faster integration for adhesion of the implant to the bone. Secondly, you don't need a second surgery. It's the same day we pull the tooth.
Got it.
We place the implant at the same time, and it cuts about 3 months off the healing process.
The implant is exactly where it's supposed to be. It was where the tooth was.
So that way, we can get the final result, which involves the abutment and the final restoration. So what is an abutment? It's the piece that connects the root-shaped screw inside the bone to whatever we can to restore. On top of that, we simply put a crown. Sometimes it's screwed in as a whole unit, and in this case, we have perfectly intact teeth on each side. If you replace the tooth now, you can actually floss in between. It's low maintenance, acts and functions as if it's their own teeth.
Are you smile ready, South Florida? Our team of smile experts at SEDA Dental use the latest technology with the best staff to deliver high-quality, affordable dental care. SEDA Dental also offers free consultations and free second opinions. Schedule your appointment today at any of our convenient SEDA Dental locations. Call 877-987-4321 or visit us at floridateeth.com to find out more. SEDA Smile, SEDA Difference, SEDA Dental.
If a patient has a tooth removed, is it important to replace it right away?
Absolutely. The best time to replace a tooth, if possible, is when the tooth is removed. It avoids a big gap and an unsightly function of bone. In addition to that, we preserve whatever's around it, and our healing powers are best as well.
That definitely makes sense.
So the advice that I give all my patients at a minimum, if they can't afford to place an implant the day of an extraction, is to add a bone graft to that site.
So this is the most recent x-ray of where you are. You have all the bone graft that we placed took.
A bone graft allows that site to heal and preserve the bone that was there. It allows us to have a window of opportunity to come back and put an implant in.
So it's like a space saver.
Exactly.
So now we're ready for the second step, which is basically replacing the foundation, placing those implants, and getting us ready for the next step, which is teeth. And then giving you those teeth for a lifetime.
So let's say I'm coming in for an implant. Can you take me through the procedure?
Absolutely. The first thing we do is we get to know each other.
Okay.
By getting to know each other, I mean we do a treatment plan, which involves a thorough medical history to see if you're a candidate for a dental implant.
Okay.
There are some cases where the patient might have medical issues or other things that we may have to consider. We might schedule that surgical extraction for a later date. On that first visit, the treatment planning and the ultimate result is all clarified and discussed. The patient is informed of all his or her options, and then we proceed to the placement of the implant after we've extracted the tooth. Raquel wanted to have her teeth straightened, so she was gonna get braces. We knew she had a fractured tooth, so we extracted the tooth, and we're at a point now where the teeth are exactly where they're supposed to be, and we can go ahead and place that implant in a position where it's gonna last you for the rest of your life.
I didn't even know I can get an implant while I have my braces on.
We usually bring our patients back from 1 to 3 weeks to check up on healing.
Okay.
At 6 weeks, we know that the implant is integrated and stabilized and is pretty much ready for the prosthesis.
That is a perfect x-ray, and it's exactly what I wanted it to be. Can't look any better. This will last you for the rest of your life.
This is the end. I'm so happy. This is my last appointment. I get my real tooth put in.
Welcome back. You excited or what?
Yeah.
It's tooth day.
Yeah.
Cool. So let's
Wait.
exactly. So we took the temporary off, and now we're gonna go ahead and fit the crown and see how that looks. The guy who did this is a genius. How does that feel?
Feels fine.
Good. Are you happy?
Yeah.
Okay. Is it better than you thought or worse than you thought it was gonna be?
Oh, much better. I feel like I have a fresh tooth. Like when they first come in. I love it.
So the big question everybody wants to know, does it hurt?
I've never had an implant before. I'm a little bit nervous about it.
Going to the dentist, I get scared when I pull up in the parking lot.
With the approach we use and the type of procedure that we do, our patients rarely need any post-operative medication. They really don't complain of anything, and over the last 20 years, most people say they don't feel a thing.
I came in, I was a little bit nervous. I thought it's gonna hurt. It didn't hurt at all. And he was fast.
Way easier than I expected. You keep waiting for some kind of pain because you know there's got to be pain. There was no pain. There was nothing. I'm kind of amazed how fast and easy it was.
Key to this, because we're not cutting any of the tooth or the gum tissue around it. So the same hole that is already open now is going to be where the implant goes. So there's no additional surgery. Rarely I'll ever use a blade to do this, or rarely we ever even use a suture.
So is this a routine procedure?
Yes, at this point in the procedure, it should take no more than 2 minutes to place the implant. I spend more time removing the root, and that's the key to the whole process.
Okay, that sounds like that might hurt.
We are not cutting any of the gum, so there's minimal trauma to the adjacent area. It does not hurt. So that's how we do a single tooth implant, where if a single tooth is extracted or removed, the adjacent teeth were healthy. We replace just that one tooth with a single implant. Straightforward, simple, easy.
SEDA Dental is offering free second opinions. Have you been presented with a treatment plan for dental work that you're just not sure about? Whether it's all on fours, dental implants, crowns, bridges, we can help. Come see why the experts at SEDA Dental are the most trusted dentists in Florida. Call us now to schedule your free consultation at 877-987-4321 or visit us at floridateeth.com to find out more. SEDA Smile, SEDA Difference, SEDA Dental.
Okay, so let's say a patient is only missing one tooth, but upon examination, you determine that the adjacent teeth are also not healthy. What options do they have?
We look at those adjacent teeth to see if they have periodontal disease or tooth decay, and we determine their options. If the teeth are present, I would extract the two teeth, place an implant in the socket of the extraction site, and then replace this bridge with an implant-supported 3-unit bridge as if nothing happened. It does two things for us. It actually reduces the cost and reduces the chances of having an additional surgery on the tooth site, and it cuts the healing down by 3 months. And the replacement bridge is very predictable, very solid. I use a protocol that is usually screwed in and is retrievable in such a way that in the future, if something happens, I can retrieve that bridge, fix it, and put it back in. However, with the current materials that we have, especially the zirconium bridges, this material is unbreakable. So we actually guarantee that it's going to survive the lifetime of the patient.
So it seems like you're simplifying the technique while also making it more affordable for the patient. That's like a win-win all around.
Absolutely. And we're reducing what we call treatment time.
I've heard people talk about a flipper, but what is that?
When somebody comes into our office with a single tooth or multiple teeth missing, they use this as a temporary device where people don't know they're missing that tooth. So it's a piece of plastic that just sits in place and is removable.
So Zeke's got a host of dental problems. He's got some missing teeth, broken teeth.
I wear a flipper, which is very annoying when you go out to dinner and you can't eat, and I want to take it out, and it's embarrassing that sitting at a restaurant and pulling your tooth out.
By wearing this removable denture, it made his life difficult in terms of eating, talking, so it's something that he wasn't happy with. He wanted something that was more permanent. So we're looking at your front tooth. We can replace it with the implant, which is something that's more permanent.
I've never had an implant. I don't know what I'm in for. Yes, I am very nervous right now, but I think the outcome is going to be worth it.
Excited?
Real excited.
All right.
I'm allergic to pain. I didn't tell you that part.
We're going to try and do it where it doesn't hurt. How's that? First, going to put some little topical. This stuff just kind of numbs it up. We got him calmed down and comfortable, and we took out what was left of that tooth. I want to get it out without destroying the bone around it. She's going to suction it right out. Perfect. We took it out, cleaned it out, and we were able to place the implant immediately. This implant's a little bit smaller at the neck region. The reason being is this tooth is going to be a smaller tooth, so we have to make sure we get the right size. Now I like to put the rest of the implant in by hand. This gives me more control. It was maybe 10 to 15 minutes from start to finish in terms of getting his tooth out, putting the implant in, and getting him on his way home. All right, so the girls got the final x-ray on their implant, right? Things are looking good. As you can see where the implant is, we're not near the sinus, so we're in pretty much perfect shape in terms of where it should be. So I get lucky every now and then. How's it going, Zeke?
Dr. Wang.
Any issues?
No issues.
Good, good. So we're gonna take the impressions, and once it sets, it'll have the impression of what your mouth looks like, and then we'll be able to make the crown off of that. We'll start to put the other components on top of the implant so that he can have a tooth on top of it, the actual tooth, the crown. And now I have something that the crown has a hole in there, and we just kind of cement it on, just like a normal crown would be done.
Okay.
So just nice cement, and we'll call it a day. So now you'll be ready for some steak dinners.
All right. About 3 years, I've had a flipper. Now I got a real tooth. And it feels good. I can't wait to eat a steak. Oh, I'm very happy. Very happy.
Are you smile ready, South Florida? Our team of smile experts at SEDA Dental use the latest technology with the best staff to deliver high-quality, affordable dental care. SEDA Dental also offers free consultations and free second opinions. Schedule your appointment today at any of our convenient SEDA Dental locations. Call 877-987-4321. or visit us at floridateeth.com to find out more. SEDA Smile, SEDA Difference, SEDA Dental.
So what if a patient doesn't want to hassle with the removable options anymore? Are there any permanent solutions?
So we have the ability to take away that framework and to replace it with something permanent and fixed, so they do not need to wear anything removable. Absolutely no adhesive, no glue. You wouldn't have to remove it and clean it. It functions and looks and behaves in the mouth as if it's your own teeth.
So what about people that are missing all of their teeth? I know a lot of people have dentures and they hate them. It covers your palate, they don't stay in place, you have to deal with all those glues. What can we do to help them?
Typically, we see a lot of patients that come into our clinics with dentures, but we're lucky that we have a lot of good solutions.
Hand them over, baby.
Hand them over. There you go.
Great transitional thing to get us to where we are, right? But this palate, it's out of here.
If we want to go the most economic route, add 2 implants, sometimes 3. In this particular instance, we'll place 2 implants on the lower jaw, or 4, and we'll put 2 pieces inside the denture, and what that allows us to do is snaps in place, in which we call the clip-on or snap-on denture.
So it holds it in place, you can chew your food better, you don't need all those nasty glues, and it's more realistic.
You get stability. It doesn't move. The tongue doesn't clunk it out of the way. These are 2 huge factors. On the upper dentures, the most common complaint, it's the palate. This piece of plastic covers the patient's palate. It recludes them and prevents them from enjoying texture of food, temperature of food, and most of all, taste. It's wobbly, it drops out when I smile or laugh. It's just not stable. They can't chew their food. They have to use a lot of glue inside it to keep it in place. It stinks, it causes an odor. It's yellow, discolored, nothing but complaints. On the upper jaw, you get to eliminate that hard palate of acrylic so you can actually taste food. So this is the most economic way of solving problems with dentures that are sore, painful, unstable. You can't chew with them. They keep jumping around out of your mouth. That's usually the typical complaint.
That definitely sounds like a better option than dentures.
When Kathy came into our office, she had so much gum disease that all the teeth were shifting at an alarming rate. In Kathy's case, we placed 4 implants. It allowed us to take her full upper denture. Okay, so what I'm gonna do now is I'm gonna remove the old denture, and I'm gonna snap them in, and you're gonna let me know how you look and how you like them. Okay. Is that fair?
Yep.
And we were able to put the implants in, spread them apart, and allowed us to put a horseshoe denture in place that snaps in and out, and she's able to A, feel more comfortable because it snaps in and out, and B, she's able to taste food because it has no palate. Open gently. I'm gonna remove these guys.
Bye-bye. Their job is done. Their show is over.
Adios. Snap in. Bite down a little bit. Bite is perfect. Tell me what you think.
Uh-oh. Wow. Wow. They're beautiful. Now I'm excited to go show them off.
I neglected my teeth more than I should have. I was missing so many teeth, I didn't smile or I didn't go out of my way to interact with people. I do lawn maintenance for a living. Even with customers, I didn't smile because you don't feel confident. You really shy away from even your friends just because you feel inadequate. Once I decided to invest in my smile, I chose SEDA Dental.
With his SEDA Dental team of specialists working together in the same facility, Tom was able to receive his new smile in just 1 day. It has never been easier for people in South Florida who have missing, broken, or failing teeth to receive their new teeth in a day.
Since I've gotten the new teeth, my customers, my friends, they all notice. They all say, "Oh, wow, you got such a nice smile. You look so happy."
Schedule your free consultation at SEDA Dental today and ask us about financing options.
Having a smile from SEDA Dental really, really changed my life.
Call SEDA Dental today.
So we've been talking about people that are looking for alternatives to replace their dentures, and we talked a bit about the SnapOn procedure. Who's a good candidate for this procedure?
Whether you're missing your upper teeth, your lower teeth, or you want to replace your existing dentures, you may be a good candidate for this procedure. Large number of patients don't even know they're candidates for these type of procedures. including patients that have dentures, upper or lower, or a combination of dentures and partials. Patients that have lost multiple teeth and they're only left with 4 or 5 teeth in each jawbone. Patients that have medical issues that could get complicated by infected teeth. Patients that have advanced gum disease, or their gum disease is so advanced that at this point, their teeth are becoming unsightly, unhealthy, riddled with infections and abscesses. This is a great option for them. We have patients that are referred to us by their physicians to remove all their teeth because they're undergoing cancer treatment, radiation therapy, or sometimes hip or joint replacement. Keeping these teeth in their mouth is detrimental to the surgeries or treatment that they're going under.
So Doc, when I hear about your practice, I'm hearing a lot about all-in-4, teeth in a day. What are these procedures?
Whether you call it teeth in a day or all-in-4, it's really the same procedure.
Okay.
We're removing your teeth, we're placing implants, and we're replacing your teeth the exact day.
Wow, one-stop shopping, no need to walk around with temporaries?
Correct.
That's incredible.
This protocol allows us to solve complex dental problems for all our patients, most of the time in one day, and give them a permanent solution where they do not have to worry about investing more money over the years into their teeth again. It's a one-time investment, but it's an investment that lasts a lifetime.
Oh my gosh, look how nice
You see Daddy's teeth? I've got to be the greatest dentist in the world. I feel like a different person. I feel great. I feel awesome.
It's a treatment approach and a treatment protocol that's available for the masses. We advise our patients to select and interview their dental implant specialists to choose the right set of skills and the appropriate amount of training and experience to pull off this procedure. We are very unique here at SEDA Dental. We have the restorative and the surgical aspect of this covered by dental implant specialists. We can perform this procedure from start to finish. We stand behind our work, and you don't have to go to multiple locations to get this done. It's done in one place. One of the questions our patients always pose to us, while you say this is a one-day procedure, or teeth in a day, how does it work? In most cases, it requires 2 visits prior to that one big day where we deliver the implants during that visit. Usually we take photos, records, impressions of the existing condition in their mouth, whether it's teeth or dentures. And then we start treatment planning and using technology to allow us to custom make that denture or specific set of teeth for you. Once we go through what we call the workup of the case, the big day is a one-day big block in the schedule where we give you our full attention so that everything's done correctly in the right amount of time to reduce discomfort, anxiety. We want to make you feel good. It varies from case to case. Some patients will have dentures, so we can actually use those dentures and convert them to permanent teeth. Some patients have multiple teeth missing, so we have to custom make teeth. So it really is case specific. All the teeth are removed and then the implants are placed at the same time through those existing sockets that are already open now to receive the implant. At the end of the day, the patient will walk out with a fixed bridge that is attached permanently, but they can function immediately that day. They can chew the next day or the same day of implant placement.
You know, with the dentures, you're always a little worried about them falling out. They'd slip on you and stuff, but now these feel so great. They're in there tight, and I feel like I can chew glass.
For the right candidate, we could remove your teeth, place implants, and give you a fixed permanent bridge without a palate. So at 5 p.m., you can go home with a brand new, gorgeous, beautiful smile.
That is amazing. So is age a factor when considering the all-on-4 procedure?
No, for example, we had a patient, Yuna, who was 75 years old.
I have to have implants because the 2 bridges that I have, the big one at the left, it's broken.
My recommendation was you need to take these teeth out because there's no other choice. Otherwise, it's going to cause pain and infection.
She had 9 teeth extracted in one visit.
1, 2, 3, 4, 5, 6, 7, 8, 9 teeth in the front. They're basically an old crown and bridge. It's been over 15 years old, and she's had everything done to it. And now they're breaking down, and there's no way to save it. So this is our last alternative at this point.
I trust him that he will do the best.
There's definitely a long-term benefit with doing the implants now than later.
We extracted all her teeth, and we placed implants and gave her teeth that same day. She had a beautiful, brand new smile by 5 p.m.
We're all set.
I didn't feel discomfort at all. New teeth.
So if someone is considering an all-on-4 or teeth-in-a-day procedure, what should they look for in an implant provider?
Great question. The first thing you have to look for is someone who understands both the prosthetic end and surgical end of implant placement and implant restoration. And that is usually someone who understands and went through formal training in dental implants.
So I know, speaking for myself personally, when I've cracked teeth in the past, my dentist referred me to the endodontist, who did the root canal, who then referred me to the prosthodontist, who did the cap. So I'm running all over town, going to all these dentists. It gets very expensive, but you're able to do all of this in-house. How is that possible?
But at SEDA Dental, we have dentists, specialists, a highly trained team. We've got the right technology to be able to keep everything under one location or one roof so that you're more comfortable and it's a lot more efficient.
And the patient doesn't have to run all over town. I bet it saves a lot of money too.
Sure does. By bringing all these well-trained doctors, whether you're a general dentist or a dental implant specialist in one place, it allows us to really elevate the level of care that you're going to receive.
So it seems like dentistry has reached a point where you're able to do things faster and more efficiently.
And with immediate function. That's the key to this. One of the biggest concerns of denture patients or patients that are about to lose all or most of their teeth, what are they going to do when I lose my teeth? That's a big threshold for everybody that crosses into the world of implant dentistry. With this protocol, the patient is not without teeth at all.
Thank you, Dr. Rubinstein. This has been so interesting. I really learned a lot today.
I hopefully explained what a dental implant is, indications for a dental implant, how to use a dental implant, whether it's a partial denture, replacing a single tooth, replacing multiple teeth, or even getting the all-on-4 technique. At SEDA Dental, we are always glad to offer you a free second opinion, free exam and x-ray. So please feel free to explore our website or give us a call. We're all about giving you the information you need to make that educated decision on how to move forward and get that dental health that you really deserve.
Thank you for joining us. Until next time, SEDA Smile, SEDA Difference, SEDA Dental.
Frustrated with loose and missing teeth? But you can't stand the idea of having dentures? Or perhaps you already have ill-fitting dentures and want to have fixed teeth that look and feel like your own again? Then the one-day SEDA Smile may be right for you. With the latest dental implant technology, SEDA Dental can replace your missing or loose teeth with fixed, non-removable teeth all in the same day as you receive your implants.
Place the implants in such a manner that they are able to house and hold full complement of teeth in one day.
We are offering free consultations and exams at all of our convenient South Florida locations to see if you're a candidate for the one-day SEDA Smile. Call 877-987-4321 or go to floridateeth.com to see if dental implants are right for you. And don't forget to ask about our affordable financing and custom payment plans. SEDA Smile, SEDA Difference. SEDA Dental.
That sweet smile.